Welcome back to the Lift Free and Diet Hard podcast. I'm your host, Andrew Coates. Join me along with industry leaders and friends on a quest to get more people through the gym door and eating and living healthier. Join me where evidence meets empathy while rejecting fitness industry fads and extremism. Let's begin. Michael Mash, I feel like I say this a lot, but long overdue to have you back, the founder of Barbell Rehab, Doctor of Personal Training, certified strength and conditioning coach. Good to see you, my friend.
Thanks for having me on, Andrew. I'm super pumped to see what we get into today.
Well, Barbell Rehab, you intentionally chose the word barbell to combine it with rehab. And we hear a lot of media, people demonizing barbell lifts, how they were more injurious. I would love to hear your perspective on, are they inherently more risky to train with than dumbbells, machines, cables, etc.?
Yeah. Short answer, no. End podcast. When it really comes down to it. I started this brand 10 years ago, and basically I had the idea of like, let's get a barbell in every single human being's hands, right? Because there's, back then, 10 years ago, no better way to load than the barbell, right? You can incrementally load it when it really comes down to it. As far as just adding, if you have 1.25 pound plates, you can add 2.5 pounds at a time, right? So I think there's always this misconception that barbell equals 405 pound low bar squat, right? It doesn't. The barbell itself is inherently scalable, right? So it can be something as simple as a 25 pound barbell unloaded. So I'm a big fan of using it. And as I mentioned, I started this company 10 years ago, and I had the idea of getting a barbell into everybody's hands. And that mission has kind of shifted to let's get as many people as humanly possible strength training with basic principles, right? So although I am Barbell Rehab, whether that's a barbell, a dumbbell, machine, we're all about just promoting general physical activity when it really comes down to it.
So we definitely anecdotally, and hey, I'm in that camp. Now I'm smart enough to know that because I no longer barbell bench press, my left shoulder does not tolerate barbell bench pressing or barbell squat. It just no longer does. And I did this stuff for years, a long time. So we definitely have a lot of these older lifters who will say things like, I don't do this anymore, but then they will conflate it with again, it's inherently injurious. It's bad. Is the problem who's doing it and how they're using the barbells?
For sure. I think you just hit the nail on the head, because whether it's 2 dumbbells, 2 kettlebells, 1 kettlebell, barbell, it's all steel, it's all free weights. And it really just comes down to effectively modifying and adjusting the load, effectively modifying and adjusting the form. And that can be done with any training apparatus when it really comes down to it. And I think this debate of, are barbells dangerous? Are free weights dangerous? I think we're missing the bigger picture. And the bigger picture being not enough people are strength training, right? We know that only 77% of Americans aren't even meeting general physical activity guidelines. So I've kind of shifted my ideas away from 10 years ago. If you would have asked me this question, I would have said every human being should low bar back squat, flat barbell bench press, and conventional deadlift. And now I am really a big fan of helping people find their big 3. So which squat variation is going to work best for you, which hinge variation is going to work best for you, and which horizontal press variation is going to work best for that client in front of you. So I like the concept of finding that human being's big 3. I think that can go a long way.
I guess that could include a safety bar squat. It can include a trap bar deadlift, a couple of tools I use fairly extensively myself and with my clients.
Absolutely.
The word barbell is in those names, right?
It is.
But I want to go back to this idea about who's doing it. I mean, I'm wise enough to realize that who are the people who generally, like me, get beaten up as they get older? The people who are doing a lot of very heavy barbell loading lifts. And by virtue, you said it earlier, a barbell is one of the things we can load the heaviest. Who is mostly saying this stuff? Guys, male lifters. I recently saw something on Threads, that's a shitstorm of awfulness in general.
Yeah.
This one was fairly innocuous, but I can't remember somebody talking about girls ego lifting. And I basically responded, I said, like, you almost never see women ego lifting. It is almost exclusively dudes who do it.
Yeah.
And I think that right there is the issue. And you alluded to load management. So I would love for you to expand upon load management in the context of why people get hurt. Anecdotally, barbells.
For sure. And it just really comes back to the concept of people get injured from doing too much, too fast, too soon after doing not enough for too long, right? Hard stop. That's what it really comes down to. And add all kind of other factors like psychosocial issues, but let's kind of step away from that for a second and really just attack this concept of the barbell. There's a big myth going around social media right now of this concept of like people need to earn the right to use a barbell, where before you even put a barbell in your hands to do a barbell bench press, you need to own push-ups, you need to own dumbbell bench, you need to like go up this chain of checking off the boxes of different exercises before even putting a barbell in your hands. And to me, that can exclude a lot of folks. I think it really comes down to just goals, okay? If I have a new client that comes in and they have a goal of using a barbell for whatever reason, maybe it feels empowering to them, maybe they're just genuinely excited, I'm going to try and put a barbell in their hands on day one. And that's just it could just be a 25-pound barbell bench press unloaded, okay? Now, am I going to, let's say we have a 75-year-old client who comes in, only goal is to be able to be more healthy, maybe play with his or her grandkids. Am I going to force a barbell on that person on the same day? No. So I think a lot of it comes down to just trying to step away from good and bad and really zoning in on the client in front of you and what their goals are. And if those goals include a barbell, I'm pulling it out sooner rather than later. If those goals don't include a barbell, well, then of course, sometimes loading with a dumbbell or a kettlebell or body weight variations works. I think we just need to get away from this concept of absolutes is what I'm really coming home to here.
And if you think about it, a barbell is external reference and it's a constraint. And I had Alex Effer on recently. We talked a bit more about constraints. So hopefully you guys enjoyed that episode. But so let's think about this. I love landmine pressing. Now, yes, with a 45-pound barbell, there are going to be certain people who have never done it. They don't have a lot of strength, that even a 45-pound barbell landmine press, empty bar, might be a bit too challenging for them. They could actually do it two hands. Like, I've never met anybody who couldn't do it two hands. But what do we got in that position? It's still a barbell. And the arced path that it presses across generally is safe for almost all but the most mangled shoulders. I've really not encountered anybody who couldn't do it. But it's a little bit of external reference, stability. It's a bit of a constraint in the path that it follows. And I find that there are going to be some people where a barbell or even a dumbbell overhead pressing motion, they may not have access to that range of motion yet for a variety of reasons, right? Injury history, et cetera, mobility. We can work on that, but they can almost always do a landmine press. Similar to what you just said, is the concept like earning the right to load, because there's earning the right to do a barbell thing, but there's earning the right to load, which I also think is kind of nonsensical. And the example I always use is, how many times have we seen someone who body weight squatting, they're a total beginner, they look like Bambi on ice, right? Or a baby giraffe on ice. It's just messy. But you hand them a light to modestly heavy goblet dumbbell. You put it in their hands. You almost don't even have to coach them or cue them. And that helps organize their body, their center of mass.
Yeah.
And that cleans up a squat with minimal external, like coaching cues, verbalizations, or even demo, right? Not that I wouldn't do those extra things, but I agree with you. I don't arbitrarily believe that you have to start with body weight, perfect the technique with body weight. If anything, the center of mass body weight sometimes is kind of awkward for people. And if you give them that extra reference, that helps them with their center of mass. And oftentimes it's just where you load a barbell. For some people, a barbell back squat, it's not a great center of mass option. Whereas if you can front load it, it's fantastic. You want to speak to that?
Yeah, for sure. And especially like if somebody has shoulder issues as far as shoulder external rotation, mobility limitation, they're not even going to be able to get a bar on their back. And this idea of like perfecting a bodyweight version before we implement load, I'm more of the camp of the load teaches, right? So we can't go too far and just throw a bunch of load on somebody and pray for the best. But we also don't want to be at the other end of the spectrum where we're like, we need to nitpick before we add load, because it's the load that teaches. And one thing I want to speak to is this idea of making things perfect before we load. When I was in physical therapy school, I did 12 weeks rotation with spinal cord and post-stroke. I can promise you with the utmost certainty, I was not focused on making form look perfect with those folks, okay? When somebody just had a stroke, we're doing sit to stands and it's looking really funky, okay? But we're just trying to get them loading and we're trying to get them functional. Same thing after spinal cord, okay? If we waited for form to look good for those folks prior to loading, we would never load. Same thing when we get older deconditioned folks in the clinic, 60, 70 plus. The loading and the form happens simultaneously. As they add more load, we're also simultaneously working on form. So I think it's the spectrum or this continuum of form and load happening kind of simultaneously versus you need to check all these boxes before you do X, Y, and Z. Does that make sense?
It does. It makes me think that improved form is a function of strength and motor learning, not a prerequisite.
I like that. I would agree with that.
Yeah, I like how that came out too. Every once in a while I say something smart, but we're the star of the show. So yeah. Okay. What about the aging lifter? So I alluded to that earlier. Is there any component to aging lifters and having any issues with barbells, independent of just the loading patterns, the load management?
Yeah, gotcha. Absolutely not. But we just want to make sure that barbells aren't the only part of their program. And that's where I think we still get some pushback when people that have not been exposed to my brand, Barbell Rehab, they hear Barbell Rehab and they're like, oh, you're only using barbells. Well, no, we're just saying that barbells are a great tool to load bilaterally, to load incrementally over a long range of motion, but we still want to include other things in the program. So I have no problem whatsoever of our older adults having some sort of barbell bench press in the program, provided it's light, provided it's tolerable, provided we've adjusted their form to make it comfortable, so long as there's also dumbbell work, body weight work. It just comes down to building full programs. Barbell rehab doesn't mean only barbells. It just means, hey, we can use barbells as part of a well-rounded program, which includes older adults. When I was in the clinic, you talked about landmine press about 10, 15 minutes ago. One of my favorite exercises I would use in the clinic would be taking like a body bar, which is essentially just a steel pipe. They make them as 8 pounds, 12 pounds, putting one of those in a windowsill and asking somebody, can you take this 8-pound bar and do a landmine press in a windowsill? That was the entry point. Have them stand back so they're not going through as much shoulder range of motion, or have them lean forward to go through more shoulder range of motion. So it comes down to just being creative, not having these preconceived notions of this is bad, this is good, and using the tool that fits your clients. And that could be a barbell, and it might not be a barbell.
A quick sponsor break for my current aspiring coach listeners. This episode is brought to you by Train Heroic. If you know me, you know I only work with sponsors I use personally and where I know the people behind the product. Train Heroic is the best online coaching software in the industry. Not only is it a great platform for one-on-one coaching, it's fantastic for group coaching and selling standalone programs. Train Heroic is used by some of my trusted friends, so I switched my online group program here, and my members love it, raving about its ease of use. Having a dedicated app means far greater reliability for my clients and has been by far my best experience with any online coaching software. Train Heroic is a proven and stable industry leader, meaning it isn't going to suddenly disappear. One of the biggest risks in choosing an online coaching software. When you start a free trial today, you'll get 90 days free to experience why I love and trust this platform. You'll get full support from their team, who've been a joy for me to work with. And I trust Train Heroic and the people behind it. Here's how to activate your free 90-day trial. It's 2 important steps. Number 1, go to www.trainheroic.com/liftfree. Step 2, reply to the email you get. It should be trials@trainheroic.com, and let them know I sent you, or go to the links in the show notes. All right, so I think we've covered the idea. You know what? Let's go a little further too. You alluded to this, but sometimes you'll hear people say that barbells aren't for beginners. Do you want to take
Oh,
that a little further?
yeah. Let me think how I want to word this. The bigger, we need to realize the bigger issue, and the bigger issue is not enough people are strength training. And there's many reasons for that, right? That is multifactorial. Whether it's time, I'm busy, perceived lack of time, perceived lack of structure. There's a million reasons why not enough people are strength training right now. And when it comes to starting a strength training program, especially for a beginner, the last thing that we want to instill is this sense that that it's dangerous, okay? Because it's the application of it that's dangerous. So I put all tools on the same level playing field when it comes to starting a strength training program. Because usually these folks that are like barbells aren't for beginners, they'll load somebody up with 100-pound goblet squat and then say that, well, you got to be able to do that before you earn the right to use a barbell. It just doesn't make sense to me. Put everything on a level playing field, because steel is steel, external load is external load. You see where I'm getting at here?
Mm-hmm.
So that's kind of what I want to say about that. And just being smart. Sure, if somebody has an injury history or maybe somebody's older, we won't be able to progress as quickly, and we may need to take smaller weight jumps. But steel is steel, external load is external load, and that's where I want to end that at, pretty much.
Good. Let's do one more barbell thing, because I think one of the other common issues with, especially bench pressing, that certainly is with squats, is the fact that it fixes both of your hands in the same position. So do you want to address that as an argument against the barbell?
For sure. It's certainly a constraint. So by fixing the hands, essentially you're fixing the wrist and elbow joint in pronation, which also fixes the shoulder joint in internal rotation. And for a lot of folks with spicy shoulders, they can't tolerate that internally rotated position, no matter whether we're doing close grip, medium grip, or wide grip, because what's similar between all three grips? The shoulder's still fixed in internal rotation. So for those folks, they're just not going to be able to do it. And that's totally fine. They can do like a Swiss bar or a multi-grip barbell bench press or dumbbells. But for somebody that does not have that sensitivity, it doesn't mean that the barbell is going to wreck them and cause an injury. We're talking about two different things here. Somebody with already a present sensitivity to internal rotation, of course, we're not going to try to fit a square peg in a round hole and force a pronated fixed barbell position on them. But for somebody who doesn't have that issue, the last thing we want to say is, hey, don't barbell bench press because it's going to cause this. We don't have any kind of evidence to support that. So that's where I want to really delineate here between current sensitivities and working around them versus somebody that doesn't have a sensitivity and fear mongering them away from certain positions. Does that make sense?
Absolutely. Okay. So I pulled a quote from your media. I found a few good ones, and we all talk about, and you said, quote, the risk of getting injured lifting weights pales in comparison to the risks associated with sedentary lifestyle. Now we know it's true. We know that it's one of those sound bites that I think it's sensational, but I think it's true. But I would love to hear you actually quantify this. Do you have anything that can contextualize the risk comparison?
For sure. As far as numbers off the top of my head, I don't have those. But what we do know for sure is that inactivity increases risk of all-cause mortality. Meaning people in general, when we really zoom out and we look at thousands and thousands and thousands of people who are inactive die sooner. Like hard stop. Inactivity leads to higher risks of high blood pressure, diabetes, osteopenia, osteoporosis, sarcopenia, metabolic disease, okay? Like, we know that strength training and cardiovascular work is the fountain of youth. So when it comes to designing a strength training program or just getting people active, something is better than nothing. And this kind of, I don't want to go too far down this rabbit hole. This goes to this argument that like you need to first learn to move well before moving. And I'm in the opposite camp. I'm like, just start moving, and moving well will come along the way with good coaching and practice. Okay. So back to the quote of all cause mortality. as we age, or just being a human, aches and pains arise. You want to know what the biggest risk factor for low back pain is? It's being a human. It's being a bipedal organism that walks on 2 feet. We just know that 80% of people will have low back pain at one point in their life, whether they strength train or not. And as we age, people get aches and pains. And I'd rather be I'd rather be strong and in pain than weak and in pain when it really comes down to it. Right? Because people who are stronger with pain tend to get over things quicker, especially because of having that baseline strength, that baseline cardiovascular fitness, reducing those risks of all-cause mortality. Those folks are going to end up doing better when it comes to overcoming pain, or at least simmering it down a bit. I feel like I'm rambling, but I'm trying to get the main point across here about that quote.
I think it's pretty solid. There is a set of data from research that I can comfortably throw out there. We've seen this show up in a lot of studies about the different sports that replicate resistance training. So we got powerlifting, CrossFit, even especially CrossFit, Olympic lifting, and the injury rates per 1,000 hours of participation generally come in that 2 to 4 injuries per 1,000 hour range, which is comparatively very low to almost all other sports. Certainly, they're low contextually, and this doesn't mean people are suffering 2 to 4 Achilles tears, full bicep tendon ruptures, ACL tears. These are mainly fairly minor tweaks and injuries along the way, right? So those are very low numbers. It may not sound like it to someone, but they are.
Yeah, shoulder tweaks, back tweaks. But it's just like the misconception or this myth of, we hear it all the time. Oh, I tweaked my back doing deadlifts. Well, deadlifts are horrible for you. Or I tweaked my back doing the bench press. Why would you do something like that? But we forget to think about all of the people who have back pain and shoulder pain who have never touched a weight in their life and are less healthy because they're not strength training. So that's what it comes back to. The core idea of that quote is, if you're going to decide to participate in strength training at the World Health Organization recommended, which is 2 times a week minimum, full body, and then cardiovascular 3 times a week or up to 150 minutes a week, you're assuming that there's going to be an injury risk with that. Hard stop. Regardless of how good of a coach you are, how good of a physical therapist you are, how good with load management, modification, or whether using a barbell, dumbbell, there is an inherent risk with strength training. But what we're trying to say is the risk of not doing that is far worse.
We sometimes hear fitness professionals, and quite frankly, there are some people who I am good friends with who I've had on the podcast. They will occasionally say things in context about certain tactics that would prevent injuries. And they tend to bias on the side of language where they're almost talking as if they can avoid injuries altogether with the people they train. What do you say to that?
Yeah. It's impossible. You can't prevent injury. You can certainly reduce risk. And that's what our job as fitness and rehab pros should really be. It's risk management. Okay. Because the other piece of the puzzle is load management is not the only risk for injury. There's other things that can increase risk for injury, like people that have stress and anxiety with poor coping mechanisms. Other lifestyle factors can certainly predispose somebody to an injury. So maybe you are the best coach in the world and your load management and your programming is dialed in, but this person is now dealing with some sort of life stressor where they're not sleeping as well. They're not eating as well. Stress is up. Anxiety is up. Diet's poor. I don't care how much perfect form, perfect programming you have, that person might be at risk of an injury. No fault of your own. I look back when I was in PT school and I would tweak my back pretty consistently the week after finals week, every year. And I would just zone in and just be mad at myself and like, what did I miss here? I know my programming is on. I was a giant ball of stress, right? So that's what was sensitizing me. So anybody that says you can full stop 100% prevent injury, the data is just not there. But don't throw the baby out with the bathwater. We can certainly reduce injury risk. And I think these folks that are saying prevent injury know this deep down, but it just sounds buzzier and cooler on social media with like bulletproof against injury, prevent injury. It's just, it's impossible.
I know my clients, and especially the ones that are trickier with this stuff. I start every in-person training session with questions like, how did you sleep? Are you hydrated? I mean, those are the two, you alluded to this, but I'll say it again. Those are the two acute things that affect risk factor in the moment. So I always dial in on those. We also cannot control people's genetics. Genetics are a significant injury risk factor. Some people don't want to hear this one. Obesity is an independent risk factor for injury, right? There are people that will freak the fuck out at the suggestion of it. It's true. They definitely contribute to the risk of orthopedic injuries over time, right? There's a lot of risk stuff in there. But again, primarily we can control through the relationship with our clients. We can actually control conversations about their sleep and their hydration, and we can adjust accordingly day to day. But yeah, load management is still where I tend to start with.
Yeah. And even if you're training somebody online, something as simple as a weekly check-in, right? A form, just like rate your overall sleep this week, 1 to 10, rate your stress 1 to 10. When I was doing online coaching, I was doing that pretty frequently because that can really guide your programming for the upcoming week, especially if you're programming via RPE, where you can essentially prescribe lower RPEs if somebody is dealing with like an acute life stressor of that nature. So it's, again, working with the program, assuming that there's always going to be an inherent risk with strength training, but knowing in the back of your head as a personal trainer, I am really helping this client level their life up and ward off some of the nastier things later in life.
I'll get back to my guest in a moment. I have cool news. I will be appearing at the King Kong booth at the Arnold Sports Festival in Columbus, Ohio, March 6th and 7th. And I'm fanatical about King Kong backpacks and duffels. They are the best quality bags. I'm long done with buying a new cheap gym bag every 6 months when the last one falls apart. My biggest problem is needing to pick between my Conquer backpack, my waxed canvas core backpack, my Plus duffel, sorry, it's downstairs, my Heritage leather. This thing is so classic. It looks gorgeous. And my Edge backpack. Sorry, you guys can't even get this one anymore. And I always have one of them with me wherever I go, the gym, work, all my travel. I rarely use traditional suitcases anymore, and the convenience is unmatched. And you can save 15% on all your orders. Go to www.knkg.com/Andrew59676. That's www.knkg.com/Andrew59676. Don't worry, just go to the show notes, the link's in there. And I hope to meet you in person at the King Kong booth at the Arnold Sports Festival. How do you respond when someone says they need to rest an injury instead of load it?
It depends. That's a very just generalized question. Mm-hmm. And I think I just posted about this morning, literally like 4 hours ago. I think it comes from the old medical model of RICE, like rest, ice, compression, elevation for an injury. And there's a couple of reasons why we don't want total rest after an injury. And the first things first, we want to make sure we rule out red flags. So as long as there's not like severe bowel and bladder dysfunction, people are having like severe numbness and pain down the legs, or anything that would like kind of suggest neurological issues, which would warrant rest and treatment. Outside of those red flag symptoms, rest is rarely the answer, because if somebody totally rests an injury, it's going to be negative both physiologically and psychologically. Psychologically first, total rest is now going to tell this person, especially if they're new to training, they might have thoughts arise such as, see, maybe I wasn't cut out for this. Why did I start in the first place? That's going to just make them mopier, more stressed out, anxious. I call it the flexoril and chill mentality of the 90s. Is like, done. We are no longer just like flexoril and chill. It is rule out the red flags, make sure nothing nasty is going on, and then get this person moving. Because in the presence of pain or an injury, from a psychological perspective, we want to keep these folks' lives as normal as possible. We want to keep them out enjoying time with their friends. We want to keep them doing the things that they enjoy doing with the people they enjoy doing them with. And this goes to another quote that I always like: doing something that you enjoy with a little bit of pain is often better than completely avoiding that activity altogether. Because again, we're trying to keep these people from spiraling negatively of now I need to rest, now I can't move. And that's going to lead to physiologically deconditioning. Deconditioning is going to lead to all sorts of things if we wait too long, right? Now we're going to have loss of muscle loss, osteopenia, osteoporosis. Now we're back on the train we were talking about earlier. That can simply just be caused by rest. So I think I should try and clarify that it's not rest alone that's a problem. It's what rest can cause. It can cause this loss of self-confidence. It can turn into this prolonged period. And now we have people that are not coming back to the gym. So I am trying to avoid total rest at all causes in our cases of situations that are not red flaggy.
Obviously, it's going to vary by nature of the injury, but is there a time window where you would want to avoid stimulus on an injured site, or is there a time where you'd want to bring stimulus in on an injured site? You want to talk to that?
And that is literally our job as physical therapists when it comes down to it. It's knowing when to push and knowing when to scale back. So if we're, first of all, let's get out of the way post-surgical cases, because in post-surgical cases, there are certainly 100% times where we need to completely offload an area. If something was just physiologically sutured together or there was surgical intervention, we want to offload that. So a period of total rest for that area is 100% warranted after a surgery. Let's step outside of surgical considerations and let's just talk acute pain, where somebody did something too much, too fast, too soon, and now say their shoulder, their elbow, their back is hot and cranky. That might be a situation too where we want total rest of that specific area in the beginning just to calm symptoms down. But it's just total rest of that area. We should still be training other faculties to our best abilities. And that's where a personal trainer can really shine, right? Somebody maybe just had a really bad shoulder injury. Well, we can still get on the bike. We can still do belt squats. So that's where we want to kind of push back, where yes, post-surgical cases and acute pain sometimes requires total rest of the affected area, but not total rest of the entire body.
I've got something for everybody on this. So a while back, and I've mentioned this before in places, but I have a resource. It's a very detailed article, research-based, on cross-education, training with an injured limb. And it has a lot of applications. It's got both the research on it. It's got literally how to program in different contexts with an injured arm or like an immobilized limb, basically. And it both makes sense on an acute, hey, you just tweaked something. You can do things with the other arm. You can do things with the lower body. Or in the case of an ongoing injury, let's say you're in a cast, you've broken something, there's a surgical repair. Well, there is a really cool and strong effect neurologically. We don't know 100% exactly how it all works. But if you have an immobilized left arm, but you actually train the right arm. We always used to think, well, we're now going to have one shriveled up arm and one giant Popeye arm. Doesn't work out that way at all. The training of the healthy opposite limb actually helps spare the muscle strength and thickness loss that otherwise would occur. And this has been replicated through a lot of research. So it's a really cool phenomenon. I knew about this research. I was doing this in practice with clients, but then I couldn't find a resource that really made it succinct, both for the end user and for trainers to apply it. So if you want it, send me a DM. I will literally send it to you. It's free on my website. It's an awesome resource.
Yeah. We got to keep people training because the systemic effects. And that's like, if we went down the rabbit hole for all of the reasons why people in pain, we give them training, or like we have them strength train. When I first came out of PT school, I was very much of the mindset of, you are hurt because you are weak. Let me give you a strength training exercise to strengthen you up so that pain goes away. But it's not that linear, and it's much more complicated. A lot of times when it comes down to it, the big benefit of giving somebody in pain strength training is just to make them a healthier human being overall. And when somebody gets healthier, what happens? Pain starts to simmer down. And it might involve that total rest of that really hot and flared up area. But that's where I think personal trainers, and this is something that we've been really trying to do with Barbell Rehab over the past 5 to 10 years, is really empowering personal trainers with how do you navigate this situation with clients in pain? Because we know that they're sometimes the folks that need it the most because they need to just get healthier in general. I could go on a tangent about that, but I'll spare you. But that's what it really comes.
No, tangent away if you want.
Yeah. So we really just need to have strength training implemented at a global level for as many human beings as physically possible. And that involves lowering the barrier, making sure that we're not injecting what I like to call thought viruses, essentially trying to scare people, not intentionally, by telling them like, you can't do this yet, or you can't do this yet. It's getting them in, finding out what they can do, not perseverating on what they can't do. And if you focus on what they can do, I can guarantee you that over time, they're going to automatically start to be able to do the things they weren't able to do.
Okay, I like that.
We'll go with that.
This episode is brought to you by Just Bite Me Meals. I work long days and I won't compromise my client experience or sacrifice my workout, sleep, or nutrition. So I needed a quality and reliable meal prep service so I could save time on cooking and shopping and have more time for the stuff that matters. Net out the cost of groceries and the service isn't as much as you might think, and regular impulsive food delivery apps, eating out, that costs way more anyway. I get more meal variety and less dishes to clean, and I've been referring clients to Just Bite Me Meals for a long time, and I recently started ordering myself. Food is great. The beef brisket tacos are my favorite so far, and there's a lot of menu choice. Your calories and macros are listed. The portions are great. You can order custom meals. They deliver to your door, or you can pick up from their storefront. And I'm sorry to listeners outside of Alberta, but Just Bite Me Meals is currently just in Edmonton, Calgary, Grand Prairie, and Fort McMurray. Ordering from Just Bite Me Meals made my life easier instantly. And you can get 10% off on all your orders using my code, Andrew Coates Fitness, all caps, on their website. That's Andrew Coates Fitness, all capitals, or go to the link and the code in the show notes.
All right. Let's take some of this stuff a little deeper then. Quote, evidence-based principles of rehab are the same regardless of professional title. Load management and graded exposure will always matter most. We obviously have talked a bit about load management, but could you explain this in context?
For sure. This just comes down to this old myth that there is a huge difference between chiropractors and physical therapists. And in the courses we teach, we open up our courses to all healthcare professionals and all fitness professionals. So in one live course, you might have, at a barbell rehab course, you might have a physical therapist that's been practicing for 40 years, a brand new physical therapist, a brand new chiropractor, an older chiropractor, a massage therapist, an athletic trainer, a personal trainer, a strength coach, right? All of these different disciplines are in the same room because we're teaching the same concepts. Rehab is rehab. And for the folks that are like anti-chiropractic, or the folks that say, oh, chiropractic is quackery, I know a lot of good chiropractors, and we actually have one on the team that I would trust rehabbing people over some other physical therapists that spout nonsense. So my big thing with that is there are good and bad practitioners with various amounts of degrees. What it really comes down to is rehab is rehab. As Greg Lehman would say, calm shit down, build shit back up. Doesn't matter what your title is. It doesn't matter. That's what I was really getting at there. And I even had some physical therapists try and tell me, oh, you support chiropractic. No, I support evidence-based principles of rehab regardless of who is applying them. Does that make sense?
Well, I've had muscle doc Jordan Shallow on the podcast. By education, he is a chiropractor, doctor of chiropractic. But this is a guy who went straight into like ripping apart cadavers, figuring out anatomy, came from a world of strength training. And the thing that you didn't say explicitly, but I will, that I think you certainly meant is strength training, appropriate amounts of resistance at different stages of rehab, all the way through to just general training of healthy people, underlies all this stuff, right? So I only work with and platform allied healthcare professionals, physical therapists, chiropractors, et cetera, who value and understand resistance training. Now, for some of those people, they're applying it directly. For some of those people, they may be, I'm great with a physical therapist who is exceptional at the passive, let's calm things down side, knows the strength training principles, but actually works in conjunction with personal trainers and strength coaches to employ those tactics. But as long as everybody values that stuff, as far as like Dr. Sam Spinelli, another great physical therapist, he's one of my favorite people on this. Dr. Susie Spurlock, this list goes on. I recently had Dr. Justin Farnsworth on, Adam Meekins. These are all people that, Dr. Katie Dabrowski, endless list of, I actually think they're all strength training professionals who also happen to be rehabilitation professionals.
Yeah, because everybody has a different calm shit down method. That's what it comes down to, right? So chiropractors tend to rely more on manipulation for calm shit down. Massage therapists tend to rely more on massage for calming things down. So it's like the calming things down part is what tends to vary from profession to profession, but it's the principles of strength training and load management that are going to pretty much be the same regardless of who's applying it. And what we know about the calming stuff down methods is they all pretty much work, right? Whether it's massage, chiropractic, stretching, myofascial release, cupping, I could go on and on. They all pretty much work to help calm things down. So it's just, there doesn't need to be this infighting of like, I need to go to a chiropractor, I need to go to a physical therapist. You need to go to an allied health professional that knows how to calm things down and build stuff up.
And I came years in these Facebook skeptic communities, and boy, they were antagonistic towards the discipline of chiropractic. So therefore I was heavily influenced by that for a long time. But I've had so many clients who have chiropractors and they feel better when they come back from this stuff. But guess what? They're also strength training with me and it helps them. And some of those chiropractors themselves lift, they talk about these same principles. So I really softened my stance on this. I mean, at the same time, you occasionally get some chiropractor who's diagnosing food allergies with a clicker and like having people hold sugar in their hands and just complete batshittery like that. Then you run. Then you get the fuck away from those people.
Yeah. And you'll have that in every profession when it really comes down to it. As long as you are using these tools as a bridge to strength training, it's a win in my book. And 10 years ago, I was in that camp where I'm like, we shouldn't put our hands on patients. It's only going to like promote dependency. Let's do a hands-off approach and strength training only. I'm much more liberal now with that ideology of like, hey, whatever we need to do to get somebody loading, let's do it.
All right, let's finish up here. Quote, your joints aren't like an old car that wear out over time. We are biological organisms. We built to wear and repair. Stop treating stress as the enemy. It's the stimulus that keeps you durable. Unpack that.
It's the concept of moving away from this concept of the body as a car and the personal trainer or the physical therapist is the mechanic that fixes the car. And moving towards this idea of the body is more like a garden where the physical therapist or personal trainer is helping the client tend to their body versus just like, this wore out, let's replace it. Because the fact of the matter is, we know that as people age, things do, and I will use this term, wear out. If we look at a chart that documents degenerative disc disease versus age, it is straight linear. The older you are, regardless of pain, the higher incidence rate of degenerative disc disease. To the point of once you're in your 80s, 96% of people have degenerative disc disease. That's almost like telling me you're breathing, right? But not 96% of people in their 80s don't have back pain. We actually see back pain peak between the ages of 30 and 50, and then actually go down after that, despite degenerative disc disease getting worse. All this to say is just because body parts start to quote unquote wear down, we don't call somebody's wrinkling skin or their graying hair wearing down. We just call that they're getting older. So yes, menisci tend to wear down as you get older. People start to get bone on bone in their knees as you get older. People start to get degenerative disc disease as they get older. but that is not the sole driver of function. As long as they are strength training and they're healthy, that can promote a huge buffer against this typical wearing down. And that's just like, when I was treating in the clinic for 4 years, I was working with a lot of these older deconditioned adults, and they would come in terrified saying, oh, my right knee hurts so bad, I got bone on bone in it. And I just wanted to tell them, yeah, you probably have bone and bone on the left one. But we don't want to say that, because then the next time they come in, they'll be like, my left knee hurts now too. It is less about zoning in on the part that is quote unquote wearing down and treating the body as a whole. Because yeah, sure, we're starting to get bone on bone in the knee. We're starting to get this disc degenerating as we get older. But it's not just a car where that part needs to be replaced. There's so many other parts of the human body, hydration, strength, mobility, that can kind of make this wrinkling on the inside not as much as a problem as one would think.
Well, you remind me of, again, I had Dr. Justin Farnsworth on recently, a lot of overlap in these concepts, and he specifically talked about cartilage in knees and how like running wasn't bad for knee cartilage. If anything, it actually promoted its health. Yeah. And I know that's slightly tissue specific, but can you speak to the nature of some of the different tissues? Maybe tendons, maybe ligaments, certainly things like meniscus and cartilage, and the balance of stress, and to what degree some of these tissues can actually be vitalized and improved across age, and how much are there tissues that, technically speaking, no, we can't actually make them better past a certain point? Can you give us some nuance there?
Yeah. So just like Justin said with running, we see the same thing with strength training. I believe there was a study done on Olympic weightlifters that had the meniscus were denser in their knees compared to the general population. So tissues adapt, whether that's cartilage, whether that's meniscus, whether that's the disc, it can all adapt. And we didn't used to think that. The one thing where we are starting to see that once we start to see disorganization and degeneration, that it's more or less permanent, can be some tendon issues. So once somebody has what's called like a degenerative tendinopathy, they get a part of their tendon, which is just basically haphazardly laid down collagen. That specific part of that tendon is probably not going to remodel back to normal with time or loading. So with the current body of evidence, there are some tendinopathies where we just assume, yeah, this is the way it's going to be. But guess what? The concept is treat the donut, not the whole. Essentially, we realize that, hey, this small part of this tendon is the way it is, but let's train the rest of the healthy, vital, like the healthy tendon. If we can get that as strong as possible, the whole of the donut ends up not being as much of a driver as symptoms. So treat the donut, not the whole. So I think the big answer to your question is just assume everything's adapting, whether that's disc, cartilage, ligaments, but do realize that in some cases of tendinopathy, those changes are going to be more permanent, but that doesn't mean that we still can't reduce pain and build strength, because the body just has so many different layers that, okay, you have a small portion of your tendon that's disorganized. Let's train the rest of the tendon. Let's train the muscles around it. And then suddenly it's not much as a problem.
This makes me think about, I recall that there is good data, like scans on experienced powerlifters' spines. Now, I think it's primarily in the bone structure. Like these people have profoundly dense and strong vertebral bone structure. I believe they also had stronger discs. I may be mistaken on that one as well. And these are people who, now again, there's a few caveats here. One is there is load management over time. I think there's also a bit of self-selection bias here. There's survivorship bias in maybe they're the ones that did wreck their shit along the way with training with bleeding edge competitive stuff. And we know that what I said earlier about the injury rates for these different things, this is also recreational stuff. Injury rates do get higher at the edges of ultra competitive sport, and it doesn't matter if it's strength sports or anything else, right? That's true. It's still not outrageous, But any more thoughts of that?
When it really comes down to it, not really, because I'll go back to the same concept that 80% of humans have back pain. Like if you step out of everything altogether, whether they train or not. So like pain and injury is just part of being a human being. I mean, that's why we can't avoid injury. We can reduce risk of it. And you'll see a lot of the low back pain literature is actually moving away from injury prevention to like, hey, here's what to do when you inevitably tweak your back in general. So it's moving towards like self-management strategies versus like injury prevention strategies. Is that kind of what you're asking?
I think so. And I think we've done a really good job across this one. I just want to make a note here. Good. Yeah, I'm satisfied. I think this is wonderful. So I want people to follow what you're doing. Your Instagram is at Barbell Rehab. And you mentioned a bunch of courses. So obviously for the coaches, everybody listening, or even the interested enthusiast, what do you guys got going on?
Yeah, so we're basically a continuing education company for fitness and rehab professionals. So we have 3 different live courses that we teach across the United States. Our flagship one, the Barbell Rehab Method, which just teaches personal trainers and fitness and rehab professionals how to coach and modify the squat, bench, deadlift, and overhead press for people in pain. Our second live course is the Barbell Rehab Weightlifting Certification, where we go through the Olympic lifts. How do you snatch, clean, and jerk for clients in pain? How do you coach it? How do you modify it around pain? What are some other exercises that we can substitute in and out if these exercises aren't working? And then finally, we're launching our new Barbell Rehab Sports Performance course, which I'm super pumped about, in March in Denver, which is going to get all down to the nitty gritty of how do we return to sport? How do we get back to cutting, pivoting, jumping, rate of force development? So that's pretty much our live course suite. And then we have 7 online courses, all CEU approved, that start to get into more of like specialty. So we have one on training female athletes, one on training post-operative, back pain, programming. So Barbell Rehab started as an Instagram page 9 years ago, and now we are a full-fledged Con Ed company, CEU approved, fitness rehab pros. Super pumped. I have an awesome team of 8 other instructors who go out and do this while I'm managing things behind the scene. So I'm just really grateful to be able to reach the audience we've reached and continue to reach.
Oh, I'm proud of you, my friend. I mean, and I've shared a stage with you, me, and some of our other friends, literally on a panel together at Kent Pros Global Conference in Toronto. I've hung out with you at other events. So you do great work. It's why you're on here. Thanks for taking the time to come on. Everybody, please go follow Michael at Barbell Rehab and stay tuned for more. Thanks, brother.
Appreciate it. Thanks for having me on.